Hello, my dear students. Our podcast today is about dental pulp. Let's go deeper into the tooth structure after knowing the tooth development and the enamel, which was the hardest tissue in the body. And then we studied the dentin and dentinogenesis. Now the dental pulp in front of us. As you see in this image, the dental pulp is completely removed from the tooth structure, taking the shape of the pulp chamber, then narrowed toward the root canal. As long as the dental pulp is surrounded by odontoblast and the odontoblast reaches by its processes, of course, into the dentin, thus dentin and pulp is called dentin pulp complex. We can't separate the dentin from the pulp because the formative cells of the dentin exist in the pulp. Thus, it's called dentin pulp complex. Of course, we know that the pulp is formed of coronal pulp, which is pulp chamber, and the root canal, which is called radicular pulp, and the radicular pulp extend with the root canals. If we have multiple roots, we have multiple radicular pulp or root canals. As we remember that there are multiple of accessory canals exist mostly in the apical third of the roots. And if we want to memorize the reason for accessory root canals formation, due to disintegration, early disintegration of epithelial sheath of Hertwig before odontoblastic differentiation, thus creating accessory root canal, or improper fusion of the tongue-like processes at the bifurcation or trifurcation area also causes accessory canal formation, as well as the presence of thick, huge blood vessel in the passage of the epithelial sheath of Hertwig. Thus, the root is formed near, surround these blood vessels, creating accessory root canal. Normally, the apical foramen is the end of the pulp, and it's very narrow apical foramen to control the passage of blood vessels and control the passage of lymph drainage, as well as it's a sort of protection from bacterial invasion from the periapical region if we have, but still any periapical infection or inflammation can reflect it on the pulp tissue, but this narrowing of the apical foramen could be considered as a protective way of the pulp. The average size of the apical foramen in the maxillary teeth could be 0.4 millimeter, while the mandibular teeth is narrower and the average size will be 0.3 millimeter. The pulp cavity morphology could be classified into several types, as we see in this image, as if we have only one root with only one root canal, it could considered as or categorized as type 1. While type 2, if we have two separate canals starting from the pulp chamber but fused together at the apex of the root and open in one apical foramen, this is called type 2 pulp cavity. If we have two separate root canals starting from the pulp chamber and end by two apical foramina, it is called type 3. We have two root canals in one root. Type 4, we have very wide canal, as you see here cervically the canal is wide, one canal, while at the apical third bifurcation of the root canal occurs, and this is categorized under type 4 root canal or pulp cavity morphology. You have to pay attention to all of these types during your endodontic treatment, as if you missed any canal, it will be a disaster and will cause failure to your endodontic treatments. Of course, the dental pulp development, we discussed this before during dentinogenesis and during tooth development, that the pulp originating from ectomesenchymal tissues, which was the dental papilla, and that filled with neural crest cells, and after dental formation, the remaining part of the dental papilla is considered the tooth or the dental pulp. Actually, the pulp should be protected and covered by the hard dental tissues, enamel and dentin, while we have a little bit exposure of the pulp cavity could occur clinically, either traumatic, the dentist induce this exposure by his or her rotary instruments or even hand instruments. This could be this could classified into traumatic exposure, or of course pathological exposure due to extension of caries or fracture of the tooth could expose the pulp, and the pulp exposure is extremely painful, causes extraordinary, unbearable pain. Thus, pulp exposure is a disaster in your clinic. The pulp exposure or inflammation causes pain, severe pain, extraordinary, intolerable pain, but you have to pay attention that we have what's called referred pain. The pulp characterized by absence of certain nerve endings that localized the pain, meaning that if the patient comes to you and say, this side is painful, I have pain in this side or in that side, this could be pulp pain. But if the patient comes to your clinic and mention this tooth is painful, as the patient localized the painful tooth, this most probably periodontal ligament infection and inflammation and disease in the periodontal ligament. Why? If we have uncertified, certain or not determined the specific tooth that causes pain, this could be the pulp pain. And in this case, we mentioned that referred pain. This case is called referred pain. Could the patient mention that I have a severe pain in the lower jaw, and by proper diagnosis, you could find the inflamed or the diseased tooth in the upper jaw. But you have to pay attention that referred pain doesn't cross the other side. If the patient said this side is very painful, you never detect the exposure at the other side. Could there be an exposure on the other side, but this exposure won't cause this pain. Thus, the referred pain from one opposing side, one quarter, and the opposing quarter never transmit to the other side. The histology of the dental pulp is, at the beginning, the definition of the pulp is a specialized loose connective tissue. Specialized loose connective tissue consists of multiple fibers, cells, intercellular substances, blood vessels, and nerves. Simply, the pulp histologically, only histologically, could be divided into two zones, peripheral zone and central or core zone. The peripheral zone, which is called odontogenic, from its name, of course, due to presence of the odontoblastic cells. Thus, this zone is called peripheral odontogenic zone, while the remained part of the pulp is called central zone or pulp core. The odontogenic zone, of course, the maestro of this zone will be the odontoblast, and the odontoblast exists adjacent to the predental. It's the matrix that the odontoblasts themselves secrete. Thus, odontoblasts adjacent to their matrices, predental, and the cell body exists in the pulp, while their processes extend into the dentin to fill the dentinal tubules. Directing toward the pulp core, we have cell-free zone, and this cell-free zone is called zone of well, and this zone, as we see here in this histological image, this cell-free zone is very important for the odontoblastic limited movement, or during metabolism the odontoplasts need a little bit movement, or the regeneration of odontoblasts. If we have dead odontoblasts, the daughter cells exist in this area, thus can differentiate into odontoblast-like cells and could perform or secrete reparative dentin, as we discussed before during dentinogenesis. Thus, this zone is called zone of well or cell-free zone. After that, the cell-rich zone. By the way, odontoblasts, cell-free zone, and cell-rich zone are the odontogenic zone. These three layers exist in the odontogenic zone. Okay, the cell-rich zone present beneath the cell-free zone, and it's composed of fibroblasts and undifferentiated mesenchymal cells. Thus, this is the peripheral zone, the odontoblastic zone that's formed of odontoblasts, cell-free zone, and cell-rich zone. While this is the odontogenic zone, and the central zone or pulp core is the remained part of the pulp. This histological section shows also the different zones: odontoblast, cell-free zone, cell-rich zone, and central zone or pulp core. The pulp cells, we have progenitor cells. Of course, progenitor cells meaning that it could differentiate into other cells. And we have formative cells, for sure. The odontoblast will be the maestro, and fibroblast will come later. We have defensive cells as a connective tissue. Normal connective tissue for sure contains defensive cells, macrophages, mast cells, lymphocytes, and so on. The progenitor cells, they are undifferentiated mesenchymal cells, while synthetic, of course, odontoblast and fibroblast, while defensive cells, macrophage, lymphocytes, dendritic cells, which is unique for the pulp, as we will discuss later, and mast cells, and these are the defensive cells that exist actually in any connective tissue. Of course, these cells are blood cells that migrate from the blood vessels through endothelial cells that line the blood vessels, and by also through fenestration or pores in the blood vessels. These defensive cells can migrate from the bloodstream into the connective tissue. The progenitor cells or undifferentiated mesenchymal cells, they are smaller than fibroblasts but similar in appearance. They are star-shaped or spindle-shaped. If we look at the cells laterally, they appear as spindle-shaped, but if we look at the cells in a top view, they appear as a star shape. Of course, they exist along the wall of the blood vessels, and these cells have the potential to form other cells, formative or defensive. These are the stem cells or progenitor cells. All over the body, we have stem cells all over the human body that can form any different types of human body tissues. And this is the differentiation of cells in Petri dish. We can differentiate the cells to form osteocytes, to form cardiac cells, to form neurons and liver cells, and so on. We can differentiate the cells to direct these stem cells for certain passage. Okay, is the pulp normally connective tissue, as any connective tissue in our body? If we have here injury in our skin, in the connective tissue, in this underneath this skin, it can regenerate easily and it can heal easily. But does the pulp regenerate or heal easily? Of course not, because any injury in the pulp could induce severe pulp inflammation and end by pulp death. So, what are the causes that make the pulp limited in its regenerative ability? And let's remember again, during dentinogenesis, we mentioned that reparative dentin could be formed in certain conditions, which is minute, non-infective exposure of the pulp, which can induce regeneration or healing of the pulp. But if we have exposure, wide exposure or infected exposure, of course the pulp couldn't heal. Why? Why we have limited regenerative ability of the pulp? The first and most significant cause that the pulp couldn't consider as normal connective tissue that could heal easily is the odontoblast cells are post-mitotic cells, which means that this is an end cell, meaning that if we cause death to the odontoblasts, they couldn't regenerate again. They haven't the ability to divide. The adjacent cells have no ability to divide. They are end cells, post-mitotic cells, couldn't show any mitosis. Okay, but if we have, as we mentioned, minute uninfected exposure, the reparative dentin could be formed, but not by the odontoblasts, but by the subodontoblastic layer or daughter cells. Okay, again, the most important and crucial cause of the limited regenerative ability of the pulp is that odontoblasts are post-mitotic, couldn't divide anymore. The second cause that the pulp cavity is enclosed, as this pulp cavity enclosed in the hard dental tissues. Thus, any inflammation or any edema can cause destruction to the pulp tissue rather than relieve the pain, as in case of our hands. As you see here in this image, when we have swollen or trauma, this swollen could be relieved easily and these swellings go back to the bloodstream and then thus healing occur. But in the pulp, any edema or any inflammatory process could cause the pulpal tissue to be more and more inflamed, ending by death. Thus, inability to perform edema can cause destruction to the pulp tissue. Also, we have no collateral blood supply as we mentioned during discussing the apical foramen, we have narrow apical foramen. This apical foramen permits the passage of blood vessels, permits the passage of nerves, permits the passage of fibers, and so on. Thus, this minimal apical foramen couldn't provide blood supply or collateral blood supply to adjacent tissues to minimize the inflammation or edema. Thus, minimal collateral blood supply impairing the immune system to control infection. As we mentioned, that the access to the blood vessels back and forth to the pulp tissue are limited by these narrow apical foramina. Thus, the pulp couldn't easily regenerate. Regarding the odontoblasts, as we mentioned, in the early stage, the odontoblasts consist of single layer of columnar cells, while later stages, the odontoblasts perform piriform shape as this piriform with the plump end containing the nucleus and narrow end toward the process that extend into the dentinal tubules. This is logical section showing the odontoblasts. These are the odontoblasts. And as we see here, some of the blood capillaries extend into the odontoblast but never extend into the dentin, never ever. And as we see here, subodontoblastic cell layer, or could be mentioned as daughter cells, that can form reparative dentin in case of odontoblastic cells death. These are the odontoblasts, longer in the crown, getting shorter toward the root to be flat as the root apex. The cells perform junctional complexes toward each other, which is called terminal bars. Thus, these terminal bars or junctional complexes keep the odontoblastic cell layers as a boundary to the pulp. This scanning microscope showing the pulp core with multiple nerves and blood vessels and odontoblasts at the periphery of the pulp and the odontoblastic processes that extend into the dentinal tubules. Regarding the fibroblasts, of course, they are numerous. They are spindle in shape. As we mentioned, if we detect the cells laterally, they appear as spindle shape, like my hand. You can see here is a spindle shape, but if you look at the fibroblast top view, it appears as star shape. Of course, the nucleus deeply stained, and the fibroblast is a protein-forming cells with multiple numerous cell organelles. This is logical section showing the nuclei of fibroblasts and the collagen fibers. This section shows also fibroblasts with a special stain and immunofluorescent technique. The fibroblast has double functions, by the way, because fibroblast is unique in this criteria. We have all of the time the connective tissue cells that perform formative function couldn't perform the degradation function as osteoblast. Osteoblast perform or form bone, while if we need to remove this bone, we have osteoclast. We have odontoblast. If we have to resorb the root, we have clastic cells. For example, odontoclast or osteoclast even can also degrade the dental tissues. But for the fibers, for the collagen fibers, the fibroblasts that form collagen can themselves degrade the aged collagen fibers or aged ground substances. Thus, the same cell has two ends. One of these ends perform formation due to presence of huge amount of Golgi apparatus, mitochondria, rough endoplasmic reticulum, ribosomes, and so on, while the other end of the cells can degrade the old collagen or old ground substances, can bring these collagen fibers or ground substance into the cells by a process is called endocytosis. Endocytosis, that I can bring old collagen fibers or ground substances into the cell. This end will be rich in lysosomes. Lysosomes, to degrade these aged fibers or ground substances, bring the raw content of these fibers as amino acids and use them again for the formation. Thus, a cell can perform recycling process. Of course, in the young pulp, the cells are large, plump, with multiple cell organelles responsible for formation. And as I mentioned, the end that's characterized by degradation of the fibers will be rich in lysosomes. The fibroblast, as any cells, shows aging, and these cells will be quiescent, as in case of odontoblast, quiescent odontoblast. And in such case, the organelles decrease, the shape reduced, and these cells are termed fibrocytes. Fibrocytes meaning that aged cells, fibroblast cells. Regarding the defensive cells, the first defensive cells is called dendritic cells, and these dendritic cells are unique for the pulp. They are antigen-presenting cells. They act as antigen-presenting cells. Of course, they near to the blood vessels, and they have multiple branches, as we see in this image, multiple branches. The other inflammatory cells or defensive cells are macrophages, and macrophages, as you see, are large nucleus, granulated. These granules represent the lysosomes that engulf the bacteria or dead cells or aged cells and so on. Thus, macrophage are one of the cells shows multiple granules in its cytoplasm. In case of inflammation, as we see here, there exhibit granules and vacuoles in their cytoplasm due to presence of lysosomes that collect the dead bodies, dead cells, bacteria, performing vesicles or phagosomes. Phagosomes meaning that the invaginated or the entrance of any particles inside the cells surrounded by lysosomes forming phagosomes. These are the macrophages during their phagocytosis of bacteria or dead cells. This is the process of phagocytosis by endocytosis. Endocytosis meaning that I have something from the external environment getting into the cells, while exocytosis meaning that I have something or secretory vesicles in the cells coming out the cells. Okay. Another defensive cells are plasma cells, and as we see here, they appear as appear to have peripheral nuclei, eccentric nuclei, and the nuclei have the shape of cartwheel appearance, and of course plasma cells responsible for antibodies production. Another inflammatory cells or defensive cells are lymphocytes that perform direct cell mediated killing and regulate the immune response. Also the mast cells, and the mast cells appear, as you see here, granulated central nucleus cells, and that produce histamine and heparin. Of course, we have fibers, collagen fibers type 1 and type 2. In the young pulp, the collagen fibers won't be so large to be fibers, but in the form of fibrils, and by age forming the fibers. The ground substance, mucopolysaccharides, glycoproteins that perform the media for the cells to move to perform mitosis if we have mitotic cells as fibroblasts or differentiation of other cells. That ground substance is very crucial for the vitality of the pulp tissues. The blood vessels, we have the blood vessels for all teeth supplied by the inferior or superior alveolar arteries. Inferior and superior alveolar arteries pass surrounding the teeth and enter each tooth from its apical foramen. The blood vessels, of course, begin at the beginning of the foramen as thick arteries, then getting thinner towards the odontoblastic layer or toward the periphery of the pulp. The blood vessels getting thinner, and with thin wall, even the wall getting thinner. As we mentioned before, that the blood vessels or capillaries are fenestrated in the pulp, and these fenestration permit the exchange of oxygen, carbon dioxide. Also this fenestration permit the passage of inflammatory cells from the bloodstream to the pulp tissue. Also we have pericytes or Roget cells on the blood, exist on the blood vessels and act as a muscle cells to control the blood vessels. The nerves of the pulp, as exactly the same as the blood vessels, enter the main nerves enter the teeth from their apical foramen, and they are myelinated nerves, enter the core of the pulp, and they getting toward the odontoblastic layer perform plexus beneath the odontoblasts. The nerves are sympathetic in nature or sensory. Sympathetic to control the contraction of the smooth muscles of the blood vessels. Of course, we have no muscles in the pulp, but the smooth muscles that exist in the wall of the blood vessels, and sensory nerves for sensation. Both contain myelinated and unmyelinated nerves. As we mentioned, that the nerves pass in the central core as myelinated nerve, and toward the odontoblast perform plexus, and this plexus of nerves called plexus of Raschkow. And from these plexus of Raschkow, unmyelinated nerves pass toward the odontoblasts to go through even into the dentinal tubules. The only response of the pulp, as we mentioned during discussion of dentin, is pain. If you apply hot, if you apply cold, if you apply pressure, if you apply any stimulus, the response will be pain. The lymph drainage, we have any inflammation or any infection in the pulp will be drained into the Anterior teeth will be drained here in the submental lymph nodes, while the posterior teeth will be drained in the submandibular lymph nodes and even could to the posterior clavicle, but it's very rare. Thus, the patient could suffer from pain in their or his or her lymph nodes. The function of the pulp will be mainly inductive, as we mentioned that the dental papillary cells, the superficial cells will differentiate into odontoblast, and these odontoblasts will induce changes in the pre-ameloblast to B-ameloblast that form enamel. Thus, the crucial role of pulp is to induce changes in the pre-ameloblast to form ameloblast and form enamel later on. Thus, the first function of pulp is inductive. Formative, of course, it forms the main bulk of the tooth, which is dentin. Nutritive, as the whole blood vessels exist in the pulp, will produce nutrition for the odontoblast and keep the vitality of the dentin. Protective, of course, due to the presence of pain is a sort of protection, as if there is caries or any disaster problem in the tooth, and the patient won't feel any issue. It will extend till reaching the pulp. Thus, the pain that trigger the patient to go to the dentist is a sort of protection. Defensive, of course, because the pulp shows a great or multiple amount of inflammatory cells, and also reparative due to presence of sub-odontoblastic cell layer that can induce formation of reparative dentin in certain conditions. By aging, the pulp decrease in size due to formation of regular secondary dentin. Also, the apical foramen decrease in size, cellular element decrease, blood vessel and nerve vitality decrease by aging, and we can find also reticular atrophy, that the fibers of the pulp become dense and aged. Also, we have pulp calcification. Pulp calcification could occur by aging in two sorts, either localized calcification or diffuse calcification. And the localized calcification or pulp stone could be true pulp stone or false denticle. Let's discuss one by one. In case of localized calcification, we have true denticle. What's meant by true denticle or true pulp stone? Meaning true, meaning that we have true dental tissue. We have dentinal tubules surrounded by odontoblasts, and in between them we can find pre-dentin. As we see here in these histological sections, we have dentin with the pink tissue, characteristic pink tissue, surrounded by pre-dentin. Let's highlight, this is the dentin, this is the pre-dentin, and surrounded by odontoblasts. Thus, we call this stone is true denticle containing true dental tissues. These true denticles are rare to occur and exist mostly at the apical foramen, near to the apical foramen. Why? Because true denticle occurred due to presence of remnants of epithelial root sheath of Hertwig, and epithelial root sheath of Hertwig that were existed to form the root. Could these remnants escape into the apical foramen and thus can provide induction to some of the pulp cells, perform odontoblast, and thus these odontoblasts form this stone. This scenario is rare to occur, that we have remnants of Pterochid furtwig invade the pulpal tissue near the apical foramen, induce changes to the dental pulp to perform odontoblast, and so on. Thus, these true denticles are rare. While false denticles are numerous, exist in the pulp tissue, all over the pulp tissue. They are just a dystrophic calcification. Some calcification without any dentina tubules pattern or predental or odontoblast, thus is just calcification. This occurred due to some degeneration occurred in the pulpal tissue, and it is a sort of body protection. The pulp protects any degeneration by forming this calcification. False denticle exist anywhere, of course, no dentina tubules, no odontoblasts, and so on. Overdose, there is a theory mentioned that overdose of vitamin D can cause these false denticles. The pulp stones, true or false, could be classified into free stone or attached stone or embedded stone according to their location. If we see here in this image, some stones exist in the pulpal tissue, thus these stones exist free, while if this stone attached to the dentin surface, this is called attached or could be embedded into the dentinal tubules or the dentin. The pulp stones come close enough to a nerve. If this occurred, could induce pain, but never ever any pulp stones cause pain unless touch nerve, which is very rare. Of course, the proximity of pulp stone to blood vessels may also cause atrophy of these vessels, but if they are numerous or big in size. Regarding diffuse calcification, as we see here, the pulpal tissue suffered from calcification, diffuse, spread calcification, and this will be on the top of a hyaline degeneration, a sort of protection also. If we have degeneration of the fibers, the calcification try to localize or to stop this degeneration by performing this calcification. It's a sort of protection. Of course, advancing age favor their development. We have a very important note that the loss of pulp results in loss of pulp function, but never losing the tooth function. The tooth still exists and can still work, but pay attention that removal of the pulpal tissue will increase the brittleness of the tooth. As we remove the vitality of the tooth becomes brittle. Thus, the endodontic treated tooth should be covered by fixed restoration, but according to the remaining sound tooth structure. If we have proper remaining sound tooth structure, we can perform restoration as endocrown, while no need for over preparation to the tooth and forming crown, and this will be discussed in the fixed prosthodontic department later on. Kindly, this video you have to watch it properly. This is a sort of homework, and during the physical lecture we will answer on paper the following questions based on this video. You have to answer what's meant by pulp revascularization, what type of teeth are targeted by revascularization, and what are the procedures of pulp revascularization based on the video you will watch. Thank you and see you inshallah on our physical lecture.